right. Hey, everybody. I am Dr. Tim Harrigan. I've got a special friend and guest and colleague, Bree. We are going to talk to you guys about some of the testing that we do in our office through Vibrant Labs. It's a phenomenal company. We always try to use literally the best of the best, whether it's, our technologies or diagnostic systems or a supplement or a technique. It doesn't matter. We're always sourcing the best stuff because this is how I take care of myself and my family. So many of you may have known that, I haven't had a prescription in 17 years. My kids have not used any medications yet in their little bodies. And we have 4 kids when we were told we would not be able to have kids. So literally that's all stuff that we do in our practice. And so I wanted to introduce Bree, our rep with Vibrant Labs. She's phenomenal. She's been so helpful with us learning how to use these systems over the years. And we just get phenomenal results. So I want to use this time to give you more information on some of the main tests that we use so that we can kind of see if there's something that you would benefit from. So Bree, I'm going to share my slides here.
Yes.
Let's see here. All right, can you see that?
Yes, perfect.
Awesome, very good. So guys, these tests are just so cool because everybody on here that's listening has always had, traditional blood work from their medical doctor, right? We go for our yearly exams and we get our CBC measured and, maybe liver enzymes and maybe, a little bit of thyroid, maybe 1 or 2 measurements for that. But guys, traditional blood work is really, I'm not a big fan of it. We have people bring in it all the time, but it's very limited, right? Bree, as you know, we can order thousands of things in the human body. If, I call up, LabCorp or Vibrant or whoever, there's thousands of tests I can do. And so when we only check for 20 or 30 of those in a yearly checkup, what does that really tell us about our body? Our human body, I've got some little toys here. So the human body is pretty phenomenal. Just Google this. It's kind of crazy to even, our brains can't even comprehend, but every second in our bodies, there's actually 30,000 billion chemical reactions every single second. So just imagine what can throw that off. Your body is so brilliant when it's unstressed, and it's even more brilliant when it is stressed because it can put up with a lot of junk, right? Our terrible diets, our mental stress, our, maybe sedentary lifestyle. It's very good at adapting, but you can imagine it's also very easy to disrupt some of those 30,000 billion chemical reactions that are literally happening every second of every day of our whole life. It's pretty amazing. Our brains can't even comprehend that number, and that's every second. So these tests give us a bigger view, a more, valuable tool and some resources to actually fix some of those things in the body, and not even fix them. We don't ever want to claim that this is treating something. It's not, but your body is designed to heal and regulate itself. So if we're trashing it with, certain foods where our bodies are sensitive to, or our thyroid's not working properly, or we have leaky gut, or any of these other issues, it's going to throw off those chemical reactions. So it doesn't really matter what we're talking about here, right, Bree? It doesn't matter if you're
Right.
a thyroid patient or a Crohn's patient or whatever. This is about literally knowing your body and adapting and constantly trying to optimize what my body would benefit from. That's the true definition of healthcare. We don't want to fall into the crisis care kind of model, right? Where we just wait for things to go wrong. Then it's many times too late, or it's going to take me another 10 years to reverse this problem that maybe took 30 years to create. It's just, we don't want to get in that pattern. So these tools are so valuable. I'm going to let you do some talking here. I get kind of passionate and excited about this stuff. But I just want to share with, some of the 6 main tests that we use and how they benefit people. So I wanted people to hear from you, Bree, kind of an expert with the company, like what, how, and why we use these tests. So did I skip ahead here on a slide? I sure did. Okay. So why don't you get into this a little bit? So this is one of the labs that we use, you guys. It's our main lab for most of these tests we're about to talk about, and it's priceless, the information we get. And so we're going to go over a few different things here: intestinal permeability, or what's called leaky gut, food sensitivities, which is very different than food allergies. Food sensitivities are really kind of the the foundation as to many times why we develop food allergies. So you could treat food allergies all day long, but if I don't correct the food sensitivities and change that in my body, you can't fix the food allergies many times. And so
Mhm.
we can also tell people if they're sensitive to certain additives, not just the foods, but other things we add to foods, micronutrients. So I just had Brie, a patient the other day, say, well, I want to test where I can literally, and they're very healthy. So I love that they're being proactive and just
Sure.
preventative, like on a whole different level than most people. So she's like, is there a test I can do that literally just tells me what I'm maybe not optimal in? She didn't even use the word deficient. What am I not optimal in? Which is very important to understand, deficient versus optimal levels.
Right.
You can have an RDA, the recommended daily allowance, but there's studies out there that show your optimal amount may be 10 times to 100 times more
Yes.
than the minimum amount, just to keep from having a disease process. So a
Exactly.
micronutrient is just phenomenal because it tells us exactly what's lacking. Thyroid, I mean, this is an underlying pandemic or epidemic. The thyroid is so important. I don't know
Mhm.
anybody that I've ever tested that has a perfect functioning thyroid. It's almost
Right.
non-existent. I think part of it is because our American lifestyles are very stressful. We don't eat very good. We don't get many foods with iodine in them, and we mess up our hormones in other ways with stress and things like that. But thyroid is part of that hormone pathway. Tick-borne illnesses, this is another kind of silent problem that people have, that they just don't know what to do with it. Most doctors don't test for this, but we all know people that are fatigued and their immune system is not working. They're sick all the time. So this test is really important, and this affects a lot of us as well. So, and then the gut zoomer, that's, we all know the gut is the second brain. 80% of your immune system is located in the gut. So these are some of the main tests. So if we want to get into some of these, I want to break these down a little bit, Bree, for people. But
Yeah.
let's start with a little bit about you and the company. And that, I think, honestly, that's one of the most important things we talk about here, because that's the foundation of these tests. It's not just a thyroid test that we're doing. We can do that with any lab. It's not just, a cholesterol test, which is very
Sure.
misleading most of the time. So what is the difference between you guys and literally every other lab out there?
Thank you so much, Dr. Tim. That was a great intro. And I love your enthusiasm with all of our tests. You've done such a great job using these so far. So yes, my name is Bree. I'm with Vibrant. I've been with Vibrant for 5 years now. Absolutely love our company. And I can honestly say that truly. I feel that our lab company is really paving the way in terms of a lot of brand new testing capabilities, markers that we're running. So really what separates Vibrant from every other lab out there, because you're exactly right, Dr. Tim, the vast majority of people don't know the difference between Quest, LabCorp, us, and everybody else that's in existence. What really makes us stand out is our technology. And you'll actually see a picture of that here on the page, this kind of funny looking plate with a bunch of raised pillars on them. But basically what that is, with that light coming down and looking at the little pillar plate, that is our microchip technology. So our company actually was founded by someone that helped to create the Pentium 3 processing chip. So that little microchip, you got it right there, that little microchip that's in our phones and computers that runs a million different tasks all at once with lightning quick speed. That's the same technology that we use in our laboratory for a lot of these blood tests. So what you're looking at there is just a picture of the actual technology being used in our lab. So essentially, we synthesize or put proteins and peptides onto the microchip, and then we run it against the patient's sample. And we can quickly and easily distinguish very minute elevations, especially when it comes to antibody response. So if you are eating something and having a response to it, but maybe it's not really causing you any symptoms, if it's elevating any sort of an inflammatory response in your body, Vibrant would be able to pick that up. And usually even months to years before a traditional lab could pick it up. It comes down to this technology being so much more sensitive in what it can detect, as well as specific. And that means finding something that could be a problem earlier, treating the patient for it earlier, and getting them to feel better more quickly before it progresses into something that could be very serious down the road. So,
And Bree, on
yeah,
that note too, I mean, it's super important for people to realize there's a lot of funny words in medicine.
yes, yes,
And
totally.
one of those is prevention. So I like to clarify that with all our patients because it's very misleading, the word prevention. You know, they've
Yes.
deemed a lot of tests that they do now, mammograms, colonoscopies, all these different tests as preventative tests. Now, I'm not bad mouthing any testing or anything, but we just need to understand where, how, and why to use those tests. Those aren't preventative tests, but that's like
Mhm.
the insurance likes to use those words because it makes it sound good. It's like, hey, you're being proactive, but it's not prevention, right? Those tests hopefully provide you an early indicator, but
Mhm.
you already have that problem typically when it shows up on those preventative tests.
Yes.
So you're not preventing anything by going for those tests. Again, hopefully it's an early indicator, but prevention is really, again, identifying stuff way before it's visible in a disease or dysfunctional process with this Pentium like chip processor to be so sensitive where we can fix things when they're just not great. You know, we can try to optimize and push it into the optimal levels, and that's throughout our whole life. You can't stop doing that. I don't care if you're 5 years old or 80 years old. It's constantly identifying what needs a little bit of help, what's not optimal,
Right.
and try to get it there so the body just works better at homeostasis, basically. So awesome, thank you.
Exactly. Definitely.
All right, so let's get into the intestinal permeability or leaky gut. That's the kind of lay term for basically. Let me give a little rundown brief for everybody so they understand this. Basically, stress, sodas, diet, anything you could think of can lead to what we call leaky gut. That's the lay term for intestinal permeability. So this is to give a visual for people. Your cells, our human body is made up of literally anywhere from 10 to 30 trillion cells, depending on who you ask. That's a lot of cells, obviously. Well, these cells are literally designed to kind of protect the outer layer is our skin. We know that that protects us from the environment, obviously. But then we have this tube inside of this outer tube called our digestive tract. And this is where we develop what's called leaky gut. So it's basically where the cells, the stomach lining basically, or gut lining goes from 3 to 5 microns. That's normal and healthy. To give you an idea how big that is, a red blood cell is typically about 6 to 8 microns. So you have these gaps between the cells in the gut. And when you get leaky gut, because of our bad healthy life or unhealthy lifestyles, you go from 3 to 5 microns all the way to 300 to 500 microns sometimes. So I always refer people, Bree, to pubmed.gov and
Yes.
just type in this keyword, intestinal permeability. There's thousands of studies showing basically how
Definitely.
most people that understand this, they're saying this is probably where autoimmune conditions come
Yes.
from, inflammation. Just imagine now that I have this, what we call a smart tube. That's what I like to call it. It's the inside tube, your digestive tract. Its job is to absorb the good stuff and keep the bad stuff out. Well, you can imagine if I go to 3 to 5 microns, keeping stuff out, and now it's a leaky gut, things are just getting absorbed directly into the body. That is not
Yep.
good, obviously. Your body's very good at putting up with stress, but remember, there's 30,000 billion chemical reactions every second. It's only going to deal with that for so long. And so if you have all this foreign stuff in your blood because you don't have a smart filter anymore, you create antibodies, you create all these reactions in the body that basically lead to other things. It could be headaches, could be digestive issues, could be anything, literally arthritis. So I want people to do their own research on this because they're tying this to most things that people talk about. They just don't correlate this issue, which is our gut health. Again, this is where our 80% of our immune system is. It's how we absorb and assimilate our nutrients to keep us alive. So this is very important. So honestly, everybody needs this, in my opinion, because I think most people have this that we've tested. Almost everybody that we've tested has had this.
Right.
So can you give us a little more rundown on maybe how and why we would use this?
Yeah, so it's interesting that science is linking chronic inflammation to almost every known disease out there. It's at least a player, if not a major cause of most diseases that we know of. And so I always thought, what's causing all this inflammation? Like why is it that everyone seems to have so much inflammation now? And I think this test is really good at breaking that down and showing us that there is a component of the GI tract where this inflammation starts directly with those cells, and that's really where so much of it begins. And if you have inflammation in the gastrointestinal tract or lining, there's a good possibility that you have it in other places of the body. So it definitely is meant for truly, honestly, I think everyone needs this test, because everyone has hidden sources of inflammation. But being that it's starting in the gut and the GI tract, we always think of what's causing that. And so much of that is caused from all of the things that you previously mentioned with our diet, and stress level and all of those environmental factors that cause those cells to become inflamed, and allow things to seep out into the systemic circulation of the body. So honestly, this test, I almost don't really like the terminology of leaky gut, because I think it gives people this preconceived notion that, oh, I have to have gut issues in order to have this test done. Quite honestly, that's what I thought when I first heard about leaky gut and this test for it. Honestly, this test has so many applications to various different symptoms. We've run this test on people and their only symptom is neurologic. And actually, if you look up Dr. Perlmutter and a lot of the leading doctors and thought leaders on leaky gut and intestinal permeability, many of them say the first symptom is not always gut related. It is usually brain fog or chronic fatigue, or maybe it's joint pain or some other form of inflammation. So we just have to, I think, keep a very open mind when we're looking at who would this be a good test for, because I truly think it could apply to pretty much anyone, especially that lives in, Western society and is eating any form of the standard American diet. I just really think it just applies to so many of us.
Yeah, and the reason I wanted to focus mainly on these tests that we're talking about right now is because this affects all of us. I mean, almost every human being that I
Yes.
could think of that we've tested or looked at has underlying thyroid problems, not like a clinical thyroid, but just an underactive or low thyroid, a non-optimal functioning thyroid.
Yes.
So this affects almost everybody. Gut health affects almost everybody. So I want to clarify too. A lot of people think leaky gut means maybe loose stools or something like that. That's not what we're talking about. I've had half the people I talk to about this, they think it's something totally different. So
Right.
yeah, so our lifespan is getting worse. In fortune.com a few months back, they actually showed our lifespan is no longer improving, but even not just plateaued. Our kids, they say, will not outlive us as parents. So that's I say that because we want people to think differently. We want to get away from some of the traditional tests, maybe, or at least add some of these tests, because it's a whole different level. And if we want to change our lifespan, which is literally getting worse as we speak, we have to do something different. So I think this is a big part of it, honestly, because autoimmune conditions, right? There's a book I just got that I haven't broke into yet, The Autoimmune Fix. I mean, most people have autoimmune type issues.
Yes.
They just don't know it, or they've been told it's something else or whatever. They was just underdiagnosed or not even tested for many times. So yeah, that's great.
Exactly.
Good.
Exactly.
And this is another one, right? Literally, so we talked about thyroid, we talked about leaky gut. Food sensitivities affect every single one of us. There's not one person that is eating perfect for their physiology right now.
Right.
So even healthy foods, right? Organic broccoli, your body could literally be have an antibody reaction or an immune reaction towards broccoli, a healthy food. So
Right.
we have, the only way to identify this, right? Because food allergies are very different. I'm going to keep this simple for people, Bree, but we have the immediate ones, which is like if you've ever had the skin prick test, the anaphylactic type test. Are you sensitive to dander and all these things? So that is really the wrong part of the immune system. That's not a bad test to run if you are worried about somebody that's anaphylactic to certain foods or cats or something like that. Obviously, you don't want them to be around that if they're anaphylactic. However, you won't fix the problem if you just avoid those things that are the immediate immune response. So this test is brilliant because it checks for the delayed response in the immune system. Is really why, we have this threshold, let's say 100%. The more foods I eat that I'm sensitive to, you just lower that threshold. So now when I do get exposed to hay fever, dander, all these other things that we're looking at mainly traditionally, those only affect you because your threshold is so low because of the food you're eating daily that affect your immune system. So this is more of an immune conversation. This is an inflammation conversation. This is, what do I need to eat specific for my body, not even genetics or blood type necessarily, but literally currently right now in my body, what will my body react to? So this test has been phenomenal. I want to read a quick testimonial, Brie. I don't think I've told you about
Oh,
this one.
yeah.
So this
Excellent.
patient came in a year ago, probably, and we, just the literally all we did with them was this food sensitivity test. And so they wanted help with all these other issues and stuff. I'm like, you know what? I think a lot of this is leading back to your food, honestly. She didn't really believe me at first and things. And I kind of forgot about her, honestly. She didn't reach out for any questions or help. But let's say 6 months later, she sent me an email basically with this. So I want to point this out too, because she did it perfectly. The program, she did it, she followed it to the T. And that's important for people to understand, that you don't just dabble in this. If you get tested, do it correctly, because it does change things in your body. It's just, it works every time. You can't say this didn't work for me. It literally does exactly what it's designed to do every single time without any hesitation. So this testimonial, she emailed me. She's like, hey, how's it going? I just want to give you an update. Literally hadn't talked to her. I gave her the program. She followed it. And she emails me this. She says, there's no way I could have lost weight this easily and kept it off for a year and a half unless I got the food sensitivity test. I just avoid those foods and the weight slowly but surely came off. I work in a bakery, and you know what? Haven't seen any of the multiple dozens of baked goods that we make. Haven't eaten, I'm sorry, any of the multiple baked goods that we make. I've worked here for 4 months now. Being thin is so much fun, and I absolutely have no desire to eat those things anymore. Thank you so much. I've gone from a size 16 to a size 8, and it's all because of synergy. And I don't even know this person very well. She came
Wow.
in, we tried to serve her and give her the best ideas we had.
Right.
We just kind of forgot about her because she didn't really ask us anything else. And this is the story we get. So it's pretty cool.
That's phenomenal. And one thing I noticed, Dr. Tim, I don't know if your slide is the food sensitivity, but mine is still on the leaky gut slide. There we go. Perfect. No, and just to piggyback off of that, it's interesting. We've heard so many of the same things as well from people that, you know, it's until you actually know where your body is having a sensitivity, where your body is reacting to different foods, because you might not always feel that in your stomach. You might not always feel like, oh, okay, I can't eat eggs. But maybe that's just an area that is causing inflammation or that inflammatory response in your body. And inflammation causes the metabolic processes to work different in the body. Like you mentioned, Dr. Tim, it affects the thyroid, it affects your hormones. That all plays a role in metabolism and metabolic rate. So inflammation, I call it like the dirty I word almost. Like inflammation is at the root of so many things, including oftentimes that stubborn weight gain that people just feel like, man, I could run 5 miles a day and, think that I'm eating super cleanly, but maybe even those clean foods, like you mentioned, broccoli or nuts or, berries, whatever it is, maybe they're fueling that inflammatory response in your body all day, causing the body to have that inflammation, hold on to the weight, and continue to be sort of incongruent. And it's not until we really identify what is causing that inflammation to bring that back down and the body can balance itself again. It's an amazing thing. That tutorial or that testimonial is amazing.
Yeah, it just totally blew me away. I mean, I hadn't heard from her in 6 months, and we get that story. So, and that's the other thing. A lot of people think food sensitivities are food allergy symptoms, or I have allergies, or all this stuff. Guys, this affects everything. I mean, if somebody gets vertigo occasionally, it could be this. If somebody isn't healing very quickly, if they're getting headaches, I mean, literally anything you can think of, this will contribute to it. Your most important process, in your body really is absorbing and assimilating nutrients, because without that, our bodies aren't here very long. They need nutrients for the cells to heal and repair over time. So it puts aside a lot of other things to deal with this digestive process. So if you're eating these inflammatory foods or things that affect your immune system, there's no telling what it can affect. But don't think this is just for, people with diarrhea or constipation or, those pretty common sense gut issues. It affects everybody. So Did you want to go
Exactly.
over this report maybe for a second, Bree?
Yes, yes. One of the other huge benefits that you will get when you do food sensitivity testing or food additive testing with Dr. Tim through Vibrant is this great customized report. We oftentimes have patients that, you come in, you get this testing done, then you follow up with Dr. Tim, and, he's giving you all this information. A lot of people feel overwhelmed. They just want to know, tell me what I can eat and what I need to avoid. Just make it easy. So that's what we're doing here. So any patient that gets these tests done, you will have a customized diet protocol for you specifically that gives you the foods that you are not reacting to that are safe for you to eat, and then the reactive foods in red there that you need to avoid. So when you come in, Dr. Tim can give this to you, go over it with you, but then you'll have something you can take home to put on your fridge and know, this is exactly my protocol that I need to adhere to for healing. And this is great. This is no extra charge. I mean, it's available to anyone that gets this testing done. It's a huge resource for so many of our patients.
Yeah, I mean, this has simplified our job as well, because it's just right
Yes.
here. Do what this says. It's that simple, and you can carry it
Yeah,
around with you and stuff. So yeah, that has been
exactly.
awesome. Once we learned about that, it's helped us out a lot.
Good.
Um, so with the food sensitivities, we also have food additives, and it's the same thing. Your body is reactive to additives, and we all add things. Whether we go to a restaurant, I always try to show people this. I'm going to cover the name so I don't get people upset with me that work here. So this is, if you can read that, it says April 2008. And if you look
Oh,
at it, it looks literally like the day you bought it. There's no fungus growing on it. It's
oh
such a
my.
dead processed food. I don't even consider this food. Your body really doesn't recognize it as food. It's going to digest it because it has to get rid of it. However, you don't really get any benefit. It's not even, I hate the word nutritious versus non-nutritious also. That's very misleading. It's either nutritious and providing your body something, or it's damaging. It's not
Right,
non-nutritious. That's
right.
sugarcoating. It's either damaging or nutritious. And so imagine how many ingredients are in this, and how many additives and chemicals and all this other stuff. There's a ton of them if you look it up. So food additives are just as important. It's all the stuff we're adding, the sauces, the
Yes.
dressings and all those things, or even just how a food is cooked. So can you maybe touch on this a little bit?
Yes. Honestly, I think this is truly one of the most beneficial tests that we have, along with our food sensitivity and our test for leaky gut. But I always think it's interesting too, because when I talk to people about getting tested for food additives, I get the response back from a lot of people that, oh, I don't eat that stuff. I eat really whole foods and cleanly. One of the things that I found out for myself recently when I was really trying to cut out a lot of food additives was exactly what you were saying earlier, Dr. Tim. If you shop in an American grocery store, or any grocery store for that matter, you are eating food additives. I think there's a misconception out there that people feel like, oh, I'm eating whole foods, and so I don't have these issues. If you are eating salad dressings, any form of condiments that you are not making yourself from home, from scratch, which who is going to do that? You're exactly right. How foods are prepared. I am shocked at the amount of times you go to a restaurant and you ask for something maybe gluten-free that you think would be gluten-free and it's not, or you're trying to avoid butter or whatever it might be, but they cook all of their vegetables in butter or canola oil or whatever it is. um, we don't realize, I think, the breadth of the processed foods that are out there. And not only that, I mean, they always say shop the perimeter of the grocery store, which is great, but it's a little bit sad sometimes when you look at our grocery stores that probably 90 to 95% of them is all the stuff in the middle that's all processed. The only things that aren't are going to be, your obviously fruits and vegetables, and maybe some of those lean proteins and things like that, which we still have to watch. But so it's just it's eye-opening for me when we started running this test, just how much we are eating that has additives already in it. This is a great list here too. We actually test for 57 different food additives, and it's things you might not always think of either. So like the dyes and different pigments in foods that you're consuming, maybe that tomato soup, they're actually putting some red food dye in that. You never know. Also, flavor enhancers like MSG. I'm amazed at, when I actually started looking at the backs of food labels, how many products still have MSG in them. I thought that that was kind of a banned substance, but it's definitely available in many foods. Just different ingredients. The emulsifiers, those are commonly found in salad dressings. Fluoride, I mean, that's in so many different things, especially our water system, unless it's filtered. Pesticides like glyphosate, that's even a big one for obviously your fruits and vegetables. If they're not organic, they're probably pretty well coated in glyphosate, which is Roundup. And then also a lot of the preservatives like citric acid and sodium sulfate, things like that, that are common, very, very common in anything packaged. And then I love our last section there is sweeteners. So we actually do test you also for both natural and synthetic sweeteners, which a lot of people are trying to, we've realized how bad some of these synthetic sweeteners are. So we've switched over to the natural side, and not that they're bad, like monk fruit, for example, or stevia. Those are natural forms of sweetener, but if it's causing a reaction for you, then that is something that's not optimal for your body, and probably would need to be removed. So this panel is, it's amazing, but
Yeah.
yeah.
It's been eye-opening for people. And the MSG
Yes.
topic, there's like, I forget how many dozens of names they can call MSG now legally, but it's
Really?
a lot. And so you won't even see MSG really on anything. They've just changed the name, like hydrolyzed protein is a word for MSG. So it's very
Wow.
misleading. You guys can all look up those keywords, but it's in almost everything. They've just changed the terminology. There's a couple dozen things they can call MSG legally now. So they're just getting more tricky at tricking us, really. It's kind of sad, but you gotta watch out for it. So
It's so
let's see
scary.
here. So let's go over the micronutrients. So this is a test, as I mentioned at the beginning, that somebody just wanted to optimize their health. They were curious if there's a test that helps them figure out if they're deficient in very specific things. And so, this isn't really a common test at all, let alone from a medical doctor. Typically they might throw in calcium, potassium, maybe a couple other things in blood work, but this is on a whole different level. So I'm going to let you get into this a little bit. And when and how would somebody use this test?
Yeah, definitely. Again, I think this test is for a lot of different patient types. I mean, obviously, the biggies that we see a lot of are really people with chronic issues that have not gotten relief. So if it feels like, we've tried supplements, we've tried maybe some different programs, we've tried removing the inflammatory foods, and something still is missing, the micronutrient is a great way to sort of find those gaps that we're not addressing. But definitely advancing age, that is a big one. Our nutrient status definitely depletes with age. Anyone with high stress or fatigue, anyone that has autoimmunity or intestinal permeability or leaky gut that we talked about before, diets that are high in processed foods, people that have taken a lot of antibiotics or even different medications, people that have had sort of unexplained weight gain or weight loss. We see this test is very important for different instances where people will start to become very nutrient depleted and start to lose weight and can't gain any weight. And of course, digestive abnormalities as well. But this test, it really truly is taking nutrient testing to the next level. So for many of your patients, I know we've all been to the doctor and they run, like you were saying before, very standard limited labs. So they might run a vitamin D, maybe a folate. They might look at iron a little bit. And, if they're okay, then great. If not, try eating more red meat or, whatever they say. But really what this test is looking at is it's breaking down, I believe it's 38 different nutrients. It's also looking at, yes, the list is here. It's also looking at a lot of those other things outside of nutrients. We call them cofactors that help the cells and all the cellular processes. And like Dr. Tim mentioned earlier, it's such a great point. We have, our body has all of these cells that are going through all these chemical processes every single second. If we don't have the adequate supply of these nutrients on board inside the cells can't function properly. They can't make energy for all the rest of the body's processes to take place. So what this test does, it's totally different than your standard blood work. It looks at these 38 nutrients both in your blood, but it also looks at them inside your cells. So we want to know how well is the cell itself functioning, how healthy is it? And we can only really assess that by measuring the nutrient inside the cell to see exactly what it has to work with. And it's not uncommon for us to uncover where someone may have a really good vitamin D level just in their blood and on a standard lab or on this test here. But then we measure that vitamin D inside their cell and it's very low. And that's an indicator of maybe some things that could be fueling sort of chronic fatigue or other chronic issues that these patients have. So this test, again, like so many of these others, is really about really finding out where that root cause is. The body is so complex, but it's so smart and intelligent. If we can zero in on what's causing that issue, this test is really, really good at finding those missing links inside the cell to help the body.
And deficiencies are a weird thing. People, they're not really what people think they are topically. If you're deficient in something, your body's very good at adapting, but what'll happen is you're going to rob those minerals, vitamins, omegas from lower important tissues. So if somebody's having any skin issues whatsoever, any hair issues, any nail issues, any of the low priority systems, even joints, your body protects your heart, your lungs and liver and stuff like that, no matter what it has to do. And so even joints, if people have arthritis or joint pain, again, skin, hair, nail issues, kind of the beauty issues, if you're having issues with those areas, you're having much bigger issues on the inside. Those are just the ones you can see. What are your organs doing that are higher priority? They're struggling. And so I think beauty is, we look at it differently. If you start having some of those issues with skin, hair, and nails, I'm worried about your health. I'm not worried about how you look. I don't care about that. But that's a dangerous thing. And this helps us identify many of those problems. So
that's awesome. A good point, Dr. Tim. It can definitely uncover maybe some hidden things that are going on deeper.
Yeah, awesome.
Yeah.
So let's get into thyroid. So most people, like I said, you do the proper tests. Most people do not have an optimal functioning thyroid. This is a big issue. It's definitely an epidemic. And most of the time, traditional blood work measures maybe one or two things from the thyroid, and that's just not enough information. For example, if my T4 is low, maybe I measure TSH as well, but if my T4 is low, a lot of people think, well, it's the thyroid. Well, that's not what that means. That means your thyroid, yeah, of course, produces T4, but there's so many other things in your body that influence your thyroid and tell it what to do based on negative feedback information and all these other variables. Just because T4 is low, how do I know it's not my pituitary gland not telling my thyroid to release as much? How do I know it's not my hypothalamus, which actually controls my pituitary gland? So it doesn't tell us where the problem is isolated. It just tells us T4 is low. It's actually almost worthless on its own. So why is this test different than traditional tests? I mean, everybody has these symptoms on here. That's why it's just so easy to say, you know what, we got to check your thyroid. I don't even care what your symptoms are or lack of symptoms. It doesn't matter. This is a weak spot on most of us.
Right. Exactly. And we're finding, you said it's a weak spot on most of us. We're finding more and more males. You always think thyroid traditionally is a female issue, but we're finding more and more males with thyroid issues and a lot of these same symptoms as well. So how Vibrance test is different for the thyroid is we really want to give you a fuller picture. You're exactly right, Dr. Tim. Most conventional doctors are going to look at a TSH and maybe a T3 or a T4 if they're lucky. And you said if they're off, it's really doesn't really tell you much beyond that. Everything is sort of a domino effect in the body. So if we have an issue with the thyroid, it could be, 5 steps further down the road or up the road that's actually causing that issue. So this is our thyroid panel here. So we try to give you a fuller picture of where the thyroid is strong, where it's not, and just how it's functioning overall. We also look at something called reverse T3, which can be very important for a lot of people that are having, issues, but maybe the other thyroid markers are normal. And then we look at the antibodies to the thyroid, which would be an indicator of an autoimmune condition of the thyroid. At that point, if you either have one of those antibodies elevated, your body's immune system is producing antibodies against the thyroid tissue. And that's a big factor that a lot of people are dealing with now. And like I say, most conventional doctors aren't even looking at that. They look at, again, the T3 or T4. If we're not testing for something, we're not going to find it. So, we feel that it is important to look at all of these major thyroid markers, because you never know. Everything else could look within the normal range to a degree, maybe not optimal, but normal. But you could have an anti-thyroid globulin antibody through the roof. Well, if your previous doctor never checked for that, who knows how many years you go undiagnosed and untreated. And that affects so many other processes in your body, like you mentioned before.
Absolutely. And this ties back to everything else we've talked about. I mean,
Exactly.
we don't really want to just do one of these tests necessarily. It's everything's connected. If I start working on this issue, but I don't change my food sensitivities, or I don't fix my leaky gut that maybe led to this autoimmune response, like how far are we going to get? So we don't want to fail people. So that's why, we want to explain all the angles, help guide people. If they think, I'll just do this test, then I'll be healthy. It's like, well, the human body is very complex. So again, there's thousands of things we can order to test in the body. But what are just a few things going to really tell us about your overall health? And every system is working together. You can't isolate your nervous system from your endocrine system, from your immune system. They literally are all interacting nonstop. That you can't affect one system without all the other systems being affected to some degree.
Totally.
So we cannot isolate things. So yeah, that's awesome. Thank you.
Exactly.
So the gut zoomer, the second brain, the cause to all disease, some people say, let alone just gut issues. I mean, how many people are only going to the bathroom maybe once a day or once a week is very common, actually. How many people have loose stools? How many people have cramping when they eat? How many people get tired after they eat? So those are just the topical ones. That's why most people think they should do this test. Absolutely not. Your gut is your second brain. I mean, it's just as important as your brain. It actually has mechanisms and biofeedback and neurofeedback loops that literally connect everything in the body. Your gut is your second brain. Just as we have to take care of this, we have to stop trashing our stomachs too with these convenient foods and processed foods and chemicalized foods. So with your kind of clinical experience and stuff, what is the best advice? How should we guide people to this test? Usually, what are the common reasons why we want to look at this?
Sure. So obviously, I mean, a lot of the people that want to do this test tend to have more GI symptoms. That tends to be the prevailing symptom for a lot of these people. So, like you said, anybody with constipation, diarrhea, chronic gas, bloating, just stomach pain, indigestion. We have so many people have GERD nowadays. It's crazy. And I think I want to say that over-the-counter medications, the most prescribed over-the-counter medication, or most purchased, I should say, over-the-counter medication just at the drugstore is hands down GI related.
Well,
So
yeah, you're talking like ibuprofen, Tylenol, aspirins, right?
yes,
Those are
yes,
so
totally.
hard on the body. We need to do a separate webinar on that topic alone,
Yes.
but you
Oh my
know,
gosh. Oh
yeah.
my gosh, I
So
know.
leaky
Um,
gut, I mean, poor absorption. There's so many issues
yes,
from those, and people just take
so
them,
many.
sometimes daily for years, not
Yeah,
knowing the actual effect, because it doesn't
exactly.
really say that on the label. But I see horrible issues with those
Oh
medications.
yeah. Yeah, and not to mention antibiotics and things like that. All of those things affect the gut, and we might not feel it right away, but over time, that's what adds up and causes a lot of these symptoms. So, but we also feel like, I mean, again, people with autoimmune diseases should definitely look into having this test. People with cardiac disease, metabolic syndrome. There's new research that's showing the gut and the bacteria of the gut are very much linked to how you actually metabolize calories from food and extract calories from food, and that impacts your metabolic rate and weight and everything else. But so many different patients could benefit from this test. So this is just a brief snippet of what we test for on this panel. I will say Vibrance comprehensive stool test is probably the most comprehensive available. We look at well over 200 bacteria of your gut, and those are really what's driving, so much of your immune health, your digestion, hormone synthesis. Everything is really housed there. So we look at over 200 of those, both good and bad bacteria. So we have both, and it's important that we have a balance of both of those. Most of us do not have enough of the healthy bacteria to offset and balance that not so healthy or pathogenic bacteria. And it's when we have that imbalance that the scales can tip really easily. And if you have, high sugar diet, or just an inflammatory diet, or maybe you have a little bit of food poisoning, anything like that, it can very easily cause an overabundance of that negative bacteria that can really just propagate throughout your gut and cause so many issues, and for many years in people too. So along with the bacteria, we're also looking at the inflammatory markers of the gut, and the digestive markers to show how you're digesting the food, as well as other fecal markers, which also gives us some indication as to how well you're digesting the food. So that's everything that's on that panel.
Well, and this report that people get back to analyze this, it's phenomenal. So there's certain trends of certain things being high or low that really paint a picture of how and why, not just, hey, this is high and this is low, which is really a disservice. Just telling you what's high and low, it doesn't really help you fix the problem. You can't just say I'm low in calcium and give somebody calcium. It doesn't work that way. Calcium is very complex in the body, and you need vitamin K and vitamin D and all these other things for calcium to do its job. So the report is phenomenal. And it literally just tells you, hey, this is, maybe tendencies towards Crohn's, or tendencies to this, or this is a pattern that fits with this. So then it opens our mind up to other possibilities, like, well, maybe we need to look at this now to kind of narrow it down, because there's nothing that just tell us what's wrong with one test, but it starts the investigation process very well. And I think this is even more important these days because people are so scared of germs. It's COVID year.
Yeah.
It's crazy what people don't understand about germs. It's hard to watch, honestly, what's going on with the news and the fear that people have. Guys, we mentioned this earlier. You're made up of 10 to 30 trillion cells. That's what the human body is made up of. It's phenomenal. Your microbiome, which is literally the germs that are supposed to be part of your body, they're on and in your body, are 10 times that amount. That's hard for people to understand. You are literally 10 times more foreign, more germs than you are your own cells. And that's your healthy body. So that microbiome has to be healthy. These germs are essential to your health. We just want to make sure the ratio is not out of balance, because that leads to other disease processes. So an analogy I heard years ago, and it just makes a lot of sense to people. Most people think of good germs as probiotics, right? Well, that's one little category, but there's so many others. There's viruses on and in our body. Shingles is there, but we don't have shingles. Why is that? Because your immune system is working. So the germs are there. You can't avoid the germs. It's impossible. But it's just hard to watch. The people just need to learn more about their microbiome. Stop using antibiotics unless you have a life-threatening situation. All these things that we're doing are just not good for this microbiome, which is super, super important. So there's a lot of work to do with our education on germs and stuff. Obviously, this year has made that pretty clear to me. But guys, we want to create almost this visual of a parking garage in our gut. Let's just say there's 10 million parking spots. There's a lot more than that, but If most of those parking spots are filled with the good germs, the good probiotics, there's not much room for the bad ones to basically
Mhm.
park and breed and cause problems. So, funny analogy I used to tell people is, toilet seats are disgusting, obviously, and I would never do this. Don't, but if I wouldn't be scared to lick a toilet seat if I had to. If somebody's going to pay me $1 million, I would probably do it. Okay, that sounds funny, but the germs are always there. If you've ever taken microbiology and you disinfect a surface, and then you come back 15 minutes later and test it again, the germs came back. You cannot disinfect everything. Germs are not the enemy. Like I said, if you lick a toilet, which is disgusting, but you're not going to get sick if your microbiome is strong. It's not the germs that cause disease. It's a weakened body. Now there's a breeding ground for those germs. That's no different than saying, hey, look outside, there's this huge pile of trash in the alley and there's flies all over it. That'd be like saying the flies cause the trash. That doesn't make
Yeah.
sense. The flies are only there because the trash is there. So if you trash your body, if your immune system is suppressed, if you don't have the proper ratio of these good germs, then that allows the flies to come or the bad germs to do harm. So a lot of misconceptions there. So I just wanted to cover that, but
Yes.
um,
And there
very
is
good.
too, I was going to just say one
Yeah,
more thing on that too, Dr. Tim. I think a lot of people always feel like, oh, when I'm doing a stool test and we're looking at all this bacteria, oh, the doctor's just going to give me a probiotic. And
right,
I've taken probiotics and it doesn't make any difference.
right.
There are one, it's very confusing. Probiotics are definitely not all equal. Dr. Tim has some amazing ones, but um, we believe heavily that food can definitely impact the microbiome. It's actually been shown in studies that food can impact the microbiome and the bacteria in it in as little as 1 to 3 days.
Yeah,
So if you're eating not great food, that's going to fuel the negative pathogenic bacteria, especially diets high in sugar and yeast and alcohol and all those things. But if you remove those foods for even a very short time, the microbiome is amazing. It will start to actually repopulate new, healthier bacterias, and those pathogenic bacterias will become less and less. So you can do a lot of good just with food that you're incorporating or removing from the diet. It's hugely impactful on the bacteria of your gut and your immune system.
absolutely. Every bite of any food, you're
Yeah.
either fueling disease or helping your health. I mean, it's really that
Yes,
simple. Again,
totally.
that goes back to the nutritious versus non-nutritious. That's just not accurate to say that. So
Right.
cool, very
Right.
good. So tick-borne illness. This is kind of a crazy thing. I think a lot of people also think this is just tick acquired, and it's really not. So, I mean, some people say, well, I've never even been in the woods. I've never had a tick on my body. It's like, it doesn't really matter. There's studies and people out there saying that you can get this from lots of other sources, including mosquitoes sometimes. So this is also a silent thing that is really hard to treat for many people. Most people check most people never get diagnosed, first of all, let alone get the proper treatment, because they just throw antibiotics and other stuff at you when you get diagnosed with this, if they even tested for it in the first
Right.
place. So what's your best advice, or what type of patient person would you run this test on?
You know, um, a lot of the things that are mentioned here, anyone that, has maybe been having some chronic issues, or maybe it's even acute, but anything like headache, neck stiffness, extreme fatigue. We also have people that have sort of ongoing fevers where they'll feel almost like they're flu-like for about a week, and then it will start to get better, and then all of a sudden, a few weeks later, it comes back. But yeah, anything like that, GI symptoms, nausea, vomiting, or diarrhea, definitely cognitive or neurologic changes that you've seen recently, definitely loss of appetite and weight loss. I know they always talk about with Lyme, it looks like the bullet
Yeah,
or the target rash. It's, very few people actually have that in all honesty, but that can certainly, or any type of rashes on the body, you could be, suspecting maybe something like this. Pain in the abdomen, dizziness and shortness of breath, and then numbness and weakness in the limbs as well. So any of those symptoms, we would definitely say, it could be something that you'd want to maybe check out.
Yeah, awesome. So let me
Yeah.
see what we're testing here exactly. So can you break this down for people a little bit?
Yes. So when it comes to Lyme testing is there's different variations. The sort of the gold standard in lab testing is Western blot, and Western blot is an antibody-based test. Western blot's been around for many years, and it really hasn't improved in terms of its technology or sensitivity. And that test carries about a 20 to 60% sensitivity rating. So what that means is that if you're going through a Western blot test for finding Lyme disease, it's really only going to pick it up about 20 to 60% of the time. And for a lot of people that have been suffering for a long time, that's really not great. So what Vibrant does is we're again using our microchip technology for this panel. And our microchip actually takes that same sensitivity from 20 to 60% all the way up to 91%. So we have a 91% chance of actually picking up a Lyme antibody or evidence of a co-infection. So it's definitely a much more sensitive test. It's also has so much more that we're testing. You can see in here, we actually have 123 different markers on this panel. So we look at your body's antibody response, which means we're watching to see if your body is actually having a response to Lyme disease or a co-infection. And what that tells us is that at some point in time, you have had the virus or the bacteria, I should say, and your body has an immune response to it. So you've been exposed to it, basically. So we test for that, but we also test for evidence of the bacteria itself. And we do that through a method called PCR analysis. And that's basically looking at the DNA or looking for the DNA of that bacteria. So we look at both of those to be doubly sure that it's either there or it's not. So that's how our panel is different. The cost of this panel also for everything that you are getting here is usually much less than what you would pay through a lot of the other larger labs that are around there. So, yes, you definitely have a very sensitive detection with this panel.
Well, and you don't necessarily have to think you have Lyme's to do this test, right? Obviously, you're
True.
getting all these other things that could literally just give
Yes.
us a picture of other infection markers that might be happening in the
Yes.
body. So it may have nothing in the Borrelia category, but then maybe 3 or 4 other things on the other categories. So
Exactly. And
yeah,
we do see that when we run this test on people where they'll be very symptomatic and it comes back and they don't have Lyme,
yeah,
which was great. But maybe they have something else going on. We also test for other pretty common viruses like Epstein-Barr, which is mono, or cytomegalovirus virus, or herpes simplex virus, HSV1 and 2. Some of those things can have somewhat similar symptoms to a degree sometimes. And so it's important we test for those things too, because you're exactly right. It may not always be Lyme. It could be something else that we need to test for. And so that's why we have such a comprehensive panel that can test you for all of those things and really rule them in or out.
yeah. This is awesome. I mean, a lot of these can be tied back to just stuff that doesn't get diagnosed. People are always looking for a diagnosis.
Yes.
What is my problem? What is causing this? Well, a symptom doesn't tell us that. A headache, I give this example to every new person that comes into our practice. A headache is not a diagnosis. A headache is
Right.
a symptom. It's a fire
Mhm.
alarm of something dysfunctional in the body. And just because you get headaches, or if you have any symptom versus no symptoms, that doesn't mean you're healthy or unhealthy. Neither direction means you're healthy or unhealthy. You can be feeling fine today. We've all heard this story from a relative or a friend, and you have a heart attack tomorrow. Well, we know
Right.
it took 20 years at least to get to that point where the first symptom of your heart disease was the heart attack itself. Your liver and kidneys can literally be 70 to 90% non-functional, and you have zero symptoms yet. You could have
Right.
stage 3 or 4 cancer in the body, you have zero symptoms. But also on the opposite end, you could take a completely optimally healthy person and they might get food poisoning and they feel like they're dying for 24 hours, right? So
Yes.
just because
Yes.
they feel like they're dying and they're vomiting and diarrhea, that does not mean they're healthy. That's actually the exact process a healthy individual has to go through to get rid of those bad germs. So a headache is no different. I've had literally patients in the past that had brain tumors causing their headache. That's not a fun conversation, but
Right.
we went through all the proper steps to get to that final diagnosis. But other people get headaches because they're dehydrated, or they're lacking minerals or vitamins, or they're eating the wrong foods, or they have a tension in their neck, or they sleep funny, or they're looking at a computer too long. So a headache does not tell us what's causing the problem. How do we fix it? So all of these tests are so important, because symptoms, you'll notice too, Bree, right? A lot of these symptoms on here are similar to the food sensitivity, similar to the
They
thyroid,
are.
similar
They
to
overlap.
everything, because you cannot use symptoms to diagnose somebody as to the cause of the problem. So that's why
Right.
these tests are so important for all of us, literally, to do, at least every few years, some of them. Because again, if you're being proactive, you don't want to wait till you have the symptoms or issues to
Right.
address it. It's much easier to fix when it's more of a, underlying issue. So cool.
Exactly.
That was awesome. So we kind of got into this a little bit. So your body is very smart. If we just throw medications at your body, it just suppresses your fire alarm. So, we could just take the fire alarm out and let the fire continue. That's literally what medications do most of the time. You're suppressing the symptoms. Now, there's a time and place for medications. It's not our job to tell you to be on or off of them at all. However, understand when they're designed and what they do and what they're actually helping, which is the symptoms. However, we all know those chemicals have to be processed in my liver and kidney, and they get stored in the body. It's a synthetic chemical. Your body's reactive to it, whether you feel it or not. It's not great for you. So it's kind of like when somebody's driving around in their car and their check engine light comes on. Medication is like just putting a piece of black tape over that. I keep driving around
Right.
now. I don't see the problem, but there's a problem somewhere. I just don't feel it yet. Then I could be driving down the freeway with my kids, and now that problem decides to show up, like that heart attack or whatever. So this is such amazing tests you guys offer, being proactive, providing optimal, care for our bodies, which is what we all want. We just sometimes don't think about it, or we're just surrounded by people that don't really remind us of it. So I think it's phenomenal what you guys have going on. We're eternally grateful for what you guys have been doing over there. And Bree, we didn't really talk about how these tests are acquired. I think there was only one stool test in here. So that kit is a take-home kit. Somebody does a stool sample. And then the other ones, I believe all of them, is you can do the pinprick technology now. Is that correct?
Yeah, yeah. Any of our blood tests that we mentioned here today are all available on a dried blood spot a collection card. So basically, our lab just ships it to the patient's home. You can open it up. It has full instructions. You just prick your finger, basically, and then there's just little circles on a card, and you just have one droplet of blood on each little circle. I think there's about 4 or 5 circles on the card, so it's very easy to fill. And then you just fold it up and label it with your name and information and send it back to our lab. And Dr. Tim has results within 2.5 weeks. So it's very convenient, easy, quick. Yeah.
So you're saying that we don't have to stick a needle in a vein and
Right.
draw 2, 3, 4, 5 vials of
Right.
blood, basically. So, and it's as accurate
Yes.
as that. Okay. So you just need a
It,
drop of blood.
yep. Yep.
That's
You definitely
phenomenal.
do.
That's
Yeah.
phenomenal. So, and that eases a lot of people. I know I've delayed some blood work in the past, maybe because I didn't just want to get poked that week or whatever. So
Yes.
that's honestly a big fear for a lot of people. So,
Sure.
there's not going to be any, use needles, there's just less variables to have other complications from drawing blood too. So I think it's phenomenal what you guys are doing. So
Exactly.
Bree, anything else you want to add here?
Just thank you so much, Dr. Tim. I think what you're doing is phenomenal. I know just in talking with you and all of your vast experience that you have, especially when it comes to these tests, I know that you're just truly helping so many people and making a difference. And I'm just so glad that we could be a part of that for you. And thank you.
Yeah, thank you so
Appreciate it.
much for those compliments. Yeah, we're kind of obsessed, honestly, with helping people. So, I'm kind of tired of
Good.
our traditional methods, because medical intervention is the third leading cause of death. People don't realize that. Medications
Yes.
is the fourth leading cause of death, just below heart disease and cancer. So, I mean, they say 5 out of 6 of us will pass from one of those issues, which are all, to some degree, preventable, of course.
Right.
So it's just a matter of getting maybe a new knowledge, new philosophy, new information so we can make different choices. Because again, I go back to our lifespan. Traditionally, what people are doing is not working. It's just not working. If we follow the lead of our neighbors, even our traditional doctors, even our, just in general, almost everybody, what we're doing as a whole is not working, or our lifespan would not be getting worse. We're barely making it to half of our lifespan potential, and it's getting worse right now as we speak. So we have to change our mindset. We have to change what we're doing. We have to change maybe some of our beliefs, and just constantly get obsessed like we are with getting new information and learning and being critical thinkers, so that we can make our own decisions. Because it's not up to me. Your health is not up to your doctor. It's not up to your spouse. It's 100% on you. So there's nobody else you can blame, but this will empower you and give you the information you need to make that happen, instead of just, again, following the definition of insanity and doing what everybody else around you is and falling into those same statistics. So thank you so much, Bree. Have an amazing week.
You're welcome. Thank
And
you for
we will,
having me, Doc. I appreciate
absolutely.
it.
We'll do more of these, I hope. So
Yes, I hope so.
awesome. Thank you, Bree. Bye-bye.
Thank you.